It is literally the weirdest therapy I have ever done in my life. It's just so simple. It's so simple and it feels like it's fake and it feels like it shouldn't work, but it does. Hello everyone and welcome back to my channel. For those of you who are new here, I am Sam and I make videos about autism and neurodiversity with a side of humour. Today I'm going to be talking about my experience with EMDR therapy, how it works, what it was like, the kind of side effects and long-term effects. At the time of filming, my entire family, minus the baby, has now had EMDR therapy. All of us have had 2 sessions each, so I feel like I have a good overview of how it works for at least our particular situation. So EMDR therapy stands for Eye Movement Desensitization and Reprocessing. And it is a relatively new therapy aimed at treating trauma and PTSD, although it is now being used to treat other conditions such as phobias and eating disorders, that sort of thing. So what exactly is it? Reprocessing sounds a little bit ominous, doesn't it? But basically it uses what's called bilateral stimulation, which means stimulating either sides of your body and therefore your brain. And the idea is that you have this stimulation on both sides while attempting to experience or relive, in a way, the trauma or the most traumatic or distressing point of a traumatic experience. Now, interestingly enough, they don't actually know exactly how it works. It was kind of discovered by accident. I think the story goes that the person was walking in the park and moving their eyes around and they were like, hey, my trauma feels better. Theories suggest that it's to do with the different types of memories. Psychology 101, you have various kinds of memory storage in your brain. You have working memory, which is like remembering things right now. So working memory is if somebody tells you a phone number, you remember it enough to kind of like write it down. And that's very much in the present. Then of course you've got long-term memory, which is kind of a different type of memory. So what they think is that by using this bilateral stimulation and simultaneously thinking about the trauma, it forces the traumatic memory from working memory, where it's kind of stimulating you constantly, into long-term storage, as it were. Because after all, trauma is, firstly, we know that it's stored in the body, and secondly, it's what is trauma if not experiencing past events as though they're happening right now and having that fear and that reaction to what's happening right now when you're not going through that event now. Doing this technique shunts the memory into long-term storage where you can look at it as if it happened in the past, and it doesn't necessarily solve it or make it go away, but it takes away that kind of trigger, the thing that affects people who've gone through trauma or people with PTSD. So let me tell you about what led me and my whole family to EMDR therapy. As many of you will know, I had a baby last year and things were good for about 3 weeks, and then on the 4th week she started crying and crying and crying and crying, and we took her to the doctor and we were like, I know babies cry, but she's really crying a lot. And they were like, don't worry, crying peaks at 9 weeks. So we were like, okay, great. We've just got 5 weeks to wait until it starts getting better. But it really didn't. And, you know, there were some days where she would be screaming. And I mean, if you have had babies or been around babies, you know what newborn screams are like. Screaming 5 hours a day plus. And people say, well, it's colic, and it's like, okay, what actually is colic? Eventually, when she was 4.5 months old, she was diagnosed with silent reflux, which is reflux except there's not a lot of vomiting, although she did do a lot of spitting up. Yeah, burning pain in your esophagus, but you don't really see a lot of it. So there's constantly this pain here when you're trying to eat, when you're trying to sleep, pretty much everything that babies do. The long story short, that's not my forte. By the time she was even diagnosed, she got taken into hospital, and that was more for us than for her. The Dutch healthcare system has been amazing during this. We have had a lot of support. But yeah, she got taken into hospital because my husband and I were not fit to take care of a baby anymore. So she was taken into hospital to start her on this new thickener, which is sort of going to help. She started getting a lot better. We got a week of sleep, and from then on things started getting better. But it seemed like the damage had been done, and I know you're thinking like, oh, baby crying. Everybody deals with baby crying, but at the hospital, they told us, we can see if there's any treatment you need. And I was a bit like, treatment? What treatment do I need? Well, having a mental breakdown inside every day, thinking that, you know, they're going to say, hey, do you want to go on some antidepressants or do you want CBT therapy? And they were like, no, we use EMDR to treat your trauma. Because apparently when they get a lot of reflux babies coming in, the parents usually always need trauma therapy. So that's a fun fact for you. If parents say that their baby has reflux, treat it like that. They're going through a trauma. So yeah, anyway, she was 4.5 months, so what was that? I don't even remember. There's a big black hole in my memory around about October, November. I think it was November she went to hospital. It was actually after things started getting better that both myself and my husband and my son noticed more symptoms of kind of PTSD. So you can imagine if they have an awareness at the hospital where they see a lot of reflux babies that parents need to be treated for trauma from crying, you can imagine the effect it had on neurodivergent parents, autistic mother and ADHD father, who both have reasonably sensitive hearing, and obviously having just given birth and then having this kind of constant it wasn't even just the constant crying, it was the inconsolable crying. At one stage it was so bad, we actually live next to, I think we live next to a psychologist, I think she is. She came over and she was like, have you heard about the 5 S's? And we were like, yes, we've heard about the 5 S's. Like the baby is literally swaddled and shushed and swung around and whatever the other 5 S's are. And she's just like, have you tried shushing the baby? And me and my husband obviously were making awful dark humour jokes about 5 different S's, which I'm sure with a bit of imagination you could guess what we were thinking would be a more appropriate 5 S's. So that was what caused the trauma. And then after it started getting better, we were noticing more like panicky reactions and more kind of like PTSD type reactions. I don't know that either of us would really qualify for a diagnosis of PTSD. I did have that earlier in my life, which I talked about in another video on trauma, which I urge you to check out because it was a very heavily researched video for that one. But, you know, you don't have to have PTSD to benefit from EMDR therapy. You don't need a diagnosis of PTSD. You can have just been through a trauma. My experience would lead me to assume that it was more effective if there is kind of a really simple source of the trauma rather than a complex PTSD kind of issue, but I don't know. That's something I don't have experience in treating. So let me tell you a little bit about how my sessions went and my experience with my own therapy. So I went in to the psychologist, and she works in the hospital, and she is actually, I don't think child psychologist is the right word, but she is like a family psychologist. So she does deal with children, but she also treats parents of reflux babies and this kind of thing. Kind of one of the first things she said to me was something along the lines of, you know, do you really want to talk about this or should we just get into it? You know, and I was like, I don't want to talk about my feelings. I've talked about my feelings at various different therapists, you know, for a very long time in my life already, and I'm just kind of done with it. I didn't really want to talk about it. And she's like, good, because let's just get started and do this. So that's one of the things that I thought was actually really nice about this EMDR therapy, is that you don't need to tell them about how you're feeling, because it's kind of assumed you're feeling terrible. That's why you're there, right? So what she did was pull out a bar, a kind of light bar about, well, you can't really see, about this wide, quite wide, on a little tripod. And the light bar had a light that you can program to do lots of different things, flash or whatever, but the one that she did was basically the light goes from here to here and back again. So it was basically a light going across like this. And the idea is that you follow it with your eyes. What she also attached to it was 2 hand buzzers, kind of like, you know, those joke handshake buzzer kind of things. But they were just basically little vibraty things that you hold, and they synchronize with the light. So when the light is on this side, this hand buzzer buzzes, and when the light is on this side, this hand buzzer buzzes. It is literally the weirdest therapy I have ever done in my life. But once you kind of get into it, you see sort of like how it works. Well, I don't know. You don't really see how it works. You're just like, what is going on? I don't understand why this is helping me feel better. What you do before the actual eye movement stuff starts is you think of you make an image in your mind. Now, I think there are ways of doing it if you're one of the people who can't make images in their mind. I think you can probably write a story or write a sentence or something like that. But you have to have a concrete idea of pretty much the most distressing period of your trauma. When you think, so she said to me, when you think about the last however many months, what is the most distressing image to you? And the important thing here is that it doesn't have to be something that actually happened. And that for parents who have had extreme sleep deprivation and don't know what's happening, or memory is unreliable or something like that, it doesn't actually matter what happened. What matters is what is torturing you inside. I had this image which was kind of a composite of various different things that had happened over and over again, where she's screaming and screaming and screaming, and I've got earplugs and headphones on, and I'm trying to calm her down with the shushing and the thing, and I'm just sort of screaming in frustration, and she's screaming, and it was something along those lines. Even though this never happened, I was like, the image had me like throwing her into her bed or something like that. But she said it doesn't have to have happened. It's just like, what is the distressing feeling bringing up? Like, so you create this kind of core of distress, and that's the image that you focus on. Then she starts with the eye movement, and so you hold the buzzers and you watch the light, and it goes on for 30 seconds. Now, it feels a bit weird. Some people have problems following the light. It makes them feel sick. There are other ways of doing it, as I'll talk about later. But for me, it was okay. It goes quite quickly, so you're sort of like zoom, 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 zoom. Oh, that was horrible. You think of this core memory, and you concentrate on that, and she said, how distressed does it make you feel? And I think that when I started, I was like 7 or 8 or something like that, like pretty distressed. I was lump in my throat and tightness in my chest, identifying where in the body it also makes you feel. So you do that for 30 seconds. And then she said to me, okay, so how has the image changed? Has the image changed for you in any way? And I was like, oh, yeah, I guess it has. And it's kind of weird because you think, well, I didn't do that. I didn't think that the image was going to change, but somehow it shifted a little bit. So I said something along the lines of, it's like the same image, but instead of throwing her on the bed, I'm putting her on the bed. Something like that, And so she goes, okay, concentrate on that. And then we do the eye movement thing again for 30 seconds. And then she's like, about halfway through, she said, sort of, what number do you feel now? How distressed does this image, when you go back to the original image, how distressed does that make you feel? And I said, oh, I don't know, a 4 or something like that. And I was like, it was very strange how you go in there. I mean, I went in extremely triggered because that morning had been really, really bad with the baby. And so I was like, I'm already triggered. Is this good for therapy? And she's like, yeah, it's fine. So I was really, really kind of quite shaken up and distressed. And I went in and, we did the things. And I was like, oh, this is making me feel better. Why is this making me feel better? It doesn't make any sense. It seems like a pseudo-therapy or a pseudo-science, but it works. Weird. The first session was basically going through this process. You start out with the image, you do the eye movement, 30 seconds of that. You say, okay, how has the image changed? And then you go again until I was brought down in terms of distress. I think by the end of it, I was on a 2 at the end of my first session. I was like, this image is kind of like sad, but it's not distressing. The first session, I was just like, wow, I was exhausted by the end of it. I mean, it is really tiring. If I would advise anyone else doing this, I would be like, don't drive home afterwards, because I had to drive home and there was a storm outside and I was just like, I was extremely tired. It is a very intense therapy, more so than I would say a talking therapy. So I had the first session and I was like, wow, this is amazing. And I came back home and the baby was making noise. It wasn't screamy noise, but it was just like noise that is quite unpleasant when you're actively being triggered. And I was like, this is weird, because I'm just like, oh, it's just a noise that happened rather than like, ah. So I came home and I was just like, I'm cured, I'm fixed, this is amazing. She said, expect it to be, for the next few days, your brain is still processing, your brain is still kind of shifting it and moving it all around. And so I thought, okay, well, I'll take it easy. So then it came to my second session and I went in all like, I don't have trauma. You don't need to fix me anymore, I'm fixed. And she went in and she was like, let's just poke around a little bit, shall we? So we went back to this initial image or whatever, and she's just like, see where it takes you. And so I was like, fine. And then we got about 2 or 3 rounds in, and then my brain just took me like to a different image entirely, which was, it was like a conflict between me and my husband that had happened, or like this feeling of, you know, because we've both been really affected by this, and like this, obviously that's been a massive strain on our relationship. So this was this really strong image of like conflict between me and my husband. And that was kind of like where the second one went. And she was just like, dig, found your trauma. There's the remaining trauma. I don't know what this is, like a little hamster or something. Hamster psychologists. There's an idea. You could keep them in a cage in your room. And then obviously we did the same process as we'd done before. So like, how is the image changing? And gradually, as I'm doing this thing, my levels of distress about the image come down to 1. Maybe they were 0. I can't remember. Did I get them down to 0? Can't remember. But that was it for 2 sessions. And she was sort of like, I think we're pretty much done. And I agreed with her. And so that helped just that extra little bit. So that was how the sessions themselves worked. And then I noticed some strange things happening with me in the next, I would say, 2 weeks after that second session. Clearly, it does something in your brain because it has an immediate effect and shunts a huge thing that's just happened into a different area of your brain, or it does something to you. And so it takes a couple of days, you kind of get used to that. And then I think my feeling from inside my brain is that your brain is kind of like processing this information, kind of like a disk defragmenter or something like that. It's like, oh, where are we putting this? Let's put this over here. You know, let's sort through this. And for me, what that translated into was resurfacing of like old emotions during that time. And so it was like I had a little kind of, is renaissance the right word? A renaissance of awfulness. I don't know, like a rebirth. Yeah, renaissance. A rebirth of a lot of emotions that I'd had in the, you know, early months postpartum. And so that wasn't very nice. But the important thing was I was like, oh, that's probably what's happening. You know, I was very conscious that this is something that was probably happening because of the EMDR and my brain was rearranging. But I think people should be aware that, you know, you can have stuff like this come up again and you're like, what do I do with these emotions? Because I feel like these emotions that are happening, they're like emotions from the past or something, and they kind of just bubbled up to the surface. It didn't really take long for them to pass. It was just like a couple of weeks of feeling a bit like wobbly, basically. I'm also quite experienced at dealing with bad emotions. Where did I get to in my story? So I had these, 2 weeks afterwards. The difference between me and other people who might be doing EMDR for trauma is that I am being, I don't want to say actively traumatized every day, but I'm going back into a situation with a high needs baby who is better, but certainly not an easy baby. And so it's kind of like constantly pushing on these buttons again. So I have to be very careful to kind of take care of myself. Whereas I think if somebody had happened, it was like a one-off trauma, then it would probably be easier to kind of like deal with it afterwards. But, you know, I'm doing all right. So let me just briefly tell you about the rest of my family. My husband had the exact same therapy as me, with the exact same woman in the same place. And from what we've talked about, his experience was very much the same as mine. He was pretty much like, after the first one, I think his was actually more effective than mine, because he was just like, the first one was done and then he went back for his second one. He had like a few weeks gap because was that when we got COVID? I can't remember. And by the he had a second session, and I don't think he really did very much into it. It didn't last very long. I think his was only like 30 minutes or something. So he had less trauma than me. He had a very similar outcome to mine, in that it was very effective, it worked almost immediately, and it kind of disconnected the trigger, which is the noise of the baby crying or that sort of thing, from the trauma that was in the past of the non-stop screaming, inconsolable crying kind of thing. So now onto my son. He was kind of the last one of us to start displaying symptoms. And he dealt with the baby's crying admirably, considering that he has he's got very sensitive hearing as well. I was surprised at how well he coped with it. What I also noticed is that for him, once the main gist of the kind of like trauma had been over, that was when he started getting the symptoms. I guess that's why they call it PTSD, because it's post-traumatic, isn't it? It's not like you have these, yeah, okay, that makes sense. But it was after things were starting to get a little bit better that anytime that she was crying, he would go up and hide under his thing, and he would start shouting at her, getting really angry at her. I mean, he absolutely adores his sister. And in the first few weeks, he would be cuddling her when she was crying. He had no issues. And then he started getting really tense. The noise sensitivity was worse at school. He was getting really, really agitated at school. We had a lot of problems getting him in, and he would be crying every single morning, even though he liked school. It was just so much overstimulation coming from a noisy house into a noisy school. And so we were like, okay, well, let's try and get him some of this as well. And this one was slightly different, because obviously for children, especially for my son, I think they would have problems following this for 30 seconds, whether it's because they're getting distracted or just because, I don't know, physically it's quite a difficult thing to do. And what they had me do was they had me write a story. They're making it child-friendly, I guess, a story of the trauma. So I wrote a story something like, once upon a time there was a mummy, a daddy, and a little boy, and we were really looking forward to the baby, blah, blah, blah. So you basically do a positivity sandwich. You start with something positive, and then you talk about the bad bit, and then you talk about the happy bit, like things are getting better, we're so excited, she's starting to walk, kind of thing. Essentially, it was quite similar. So the therapist asked him to say, okay, which is the most distressing bit of the story? And of course, my son is hyperlexic, so he's reading this like long, dense story, trying to find the right line, kind of thing. And he's like, oh yeah, it's the bit where she cries. He's so funny. She said, okay, good, let's concentrate on that. So together they drew a picture of him under the covers, looking sad, and there's a baby crying, and so they drew a little picture. And that was you had the story, and then you had the picture to kind of solidify this thing. And she said, how does it make you feel? Not on a scale of 1 to 10, but she had, sad, different facial expressions of sad and angry and stuff like that. And I was quite surprised, because he was like, it makes me sad, and then it makes me angry. So he's quite able to identify his emotions, which I'm quite proud of him for that, actually. So you might be wondering, okay, if they don't do the lights, what do they do? I'm wondering if you can actually see. Hold on, yeah, much. On the awesome spectrum. So what the therapist did was hold out her hands like so. She would have her hands like this, and what he was doing was like this, but really, really fast and really, really, that is also bilateral stimulation. You are stimulating each of the different sides in turn. And he would do that for as long as he could, really, which was probably less than 30 seconds, but he would do that. And then she would go, so how do you feel now? How does the image feel, or something? And so it was a similar process. You do it in rounds. You think about the image, you do the bilateral stimulation in whatever form, and then you say, how has it changed? How do you feel now? And you kind of go through that. And luckily for my son, he also saw a great improvement after one session. He was just like, I'm happy, I'm fixed now, woo, kind of thing. So that went well. We did go back for a second session, and he probably would have started out with a 5 if there were a number. He said he was a bit sad, but it didn't take very long. He was happy again, and he didn't view all of this as kind of so distressing. So basically, he was done in 2 sessions, although he's got a weird fixation that he really needs to have a 3rd session, and I don't exactly know why that is. But I don't think it's because, I think it's because he's fixated on something else, possibly the number 3. But basically, he was done in 2 sessions, and what we noticed was that he's getting much less angry at his sister. He's giving her cuddles. He doesn't mind when she makes sort of tolerable baby noises anymore. Is there any such thing as a tolerable baby noise? I don't know. And so I was actually quite amazed at how kind of low tech of treatment that was, because, theoretically you could do that one at home, couldn't you? If you knew how to do it. I actually wonder, I think you can do it online. I think you can do online EMDR therapy via Zoom, and I wouldn't be surprised if you could do it yourself, although I probably wouldn't recommend it if you don't know what you're doing. It kind of took a weight off me, because I thought, well, in the future, if I ever go through something traumatic again, like, I know that there's a way that I can help myself, and I don't have to suffer like I did back when I was in my early 20s. I had a head injury, and I was suffering for it was like a year of suffering. I was firstly just amazed at how effective and how quick and how simple it was. You don't have to talk about your feelings. And also, you know, consequentially how much cheaper it is than any other kind of therapy. That was my family's experience with EMDR therapy. And I know, disclaimer, that it doesn't work for everyone. I know there are some people that can't do the eye movements, which is why there are hand buzzers, and you can do tapping. You can also do leg tapping. I don't know how you would do it for people with different disabilities, but there are, as long as it's bilateral stimulation, there is probably a way of doing it. And it's just so simple. It's so simple, and it feels like it's fake and it feels like it shouldn't work, but it does. You know, I'm really sorry if it doesn't work for you, but I think it really works for a lot of people. And you know, if anyone's suffering from a touch of trauma, I'm like, have you tried EMDR? I'm one of those people now. I don't see any reason why it should work differently on autistic people than on neurotypical people. I think the only barrier might be if you struggle with the eye movements. I don't think that our brains are so fundamentally different in terms of memory storage and trauma. Maybe a bit more sensitive to trauma, but I don't think that being autistic is necessarily the barrier. So I hope that you've enjoyed hearing about my experience, my trauma. So let me know if you've had this therapy and if it had a similar kind of effect for you, because I'm really interested to hear about other experiences. I don't know anyone else who's had EMDR therapy. Actually, no, I do know. One of my friends has had it. And she also had that 2-week kind of weird period of adjustment. So that's something to think about. So if you've made it to the end of the video, thank you so much. That's pretty impressive attention spanning. Well done you. Don't forget to like and subscribe and all that jazz, and I'll see you next time. Bye. Jim, 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 Jim. So now I'm giving myself EMDR therapy at home.